Mohit Mehrotra. I've been living in Bangalore. Bangalore is my home for the last 21 years. My experience has been that I used to work for large multinational companies, and there was earlier no need for us to buy any insurance because the company where I was working used to pay complete, they would take care of all health insurance earlier. But as I was getting older and somewhere around 45, I said, maybe this is a good time for me to try out health insurance. I accidentally happened to be introduced to the concept of health insurance by my advisor, Mr. Milind. And Milind has been a very consistent advisor since then. And he said, sir, try karo, because although your company covers it, but it's a good idea to enroll early because then the premiums are low. And I'm glad that I took that advice, because when I enrolled, when I was about 45, the premiums were quite reasonable. We got into a family floater policy. We took a 6 lakh rupees, I think it was a 10 lakh rupee cover for our family. And this must be somewhere around 2013 or so. Subsequently, in 2017, my younger daughter fell quite seriously ill. She had appendicitis and it burst, and so she was in a very critical condition and admitted in Manipal hospital for about almost for 20 days. And during that period, we had a significant bill crossing about 5 lakh rupees. I would say that my claim settlement process took some time, but eventually everything came, and I got almost everything, whatever was permissible. That experience was instrumental in me continuing the policy to pay the policy premium. We continued to do that, and then 2021, COVID happened, right? And both me and my wife were admitted again to Manipal hospital. We were there for about a week, almost 10 days, during which time my claim got settled in a cashless manner because I had more severe infection. My wife's claim was could not, but before that I must tell you that in that entire settlement process, I remember meeting a gentleman who I think was who's the head of the branch now here, I'm understanding, Sinu Joseph, right? He was very helpful. At 10 o'clock in the night, I remember I called him from Manipal hospital and said, please settle my claim in a cashless manner. He was on the call and he got us discharged, by taking the hospital through the entire process of claim settlement. And this again happened on a weekend. I don't know why these things happen over weekends. We were satisfied and we were confident that my wife's claim will also be settled, because mine happened in a cashless manner. Her claim settlement process took a little longer, and I cannot be dishonest in saying that it just happened immediately. We had to go through a bit of escalation, but I later on understood from the advisors that this was an unusual period when so many claims were piled up by all insurance companies. So today, I must say that two of your very young officers, Mr. Sumant and then Mr. Praveen, both of us, I approached them and I said, look, my claim has not been settled for a year now almost, and they took it upon themselves, and in about 15 days they took that entire process, and today I am happy that almost 2 lakh rupees of claims were settled completely to my satisfaction. And many a times, it is the people who make a lot of difference. It's the people who are trying to. It's your employees of the company who try to make the difference, make the smiles come on our faces. And I was just reading "Smile Karo and Claim Kar Le." I think it says that. Yeah, I think that is exactly how. So ultimately, a company is made up of its processes, and company is made up of its people. I always also like to remind advisors that stop sending good morning messages. That's not what gets you a policy, right? What gets you a policy is a real experience of having taken a customer through a difficult situation, having been with them and having brought solutions, being involved in the claim settlement process. So my experience has been that your officers have been truly standing by the policy, and we've been left as happy, satisfied customers. Recently, as a result of this, I decided to go for a top-up claim. So this was something new that was introduced to me. So we had a 10 lakh cover, and I have gone for a top-up of 90 lakhs. I was wondering, why do I need it? But I said, look, I'm getting older, I'm 54 now. Again, get these top-up claims early rather than getting them late. I think that's my message to whoever is taking these policies.